Hi, I'm Dr. Julie Fietta. Welcome to today's app overview. Today we're going to be talking about the BrainTest app, and here's what it looks like. The BrainTest app houses an electronic version of an assessment called the Self-Administered Geroncognitive Exam, or SAGE assessment. The SAGE is used to assess your cognition, the way you think and your brain functions, to detect early changes. This way you know whether or not you should talk to your doctor about the potential for changes or decline in your cognition. As we age, topics like memory decline or changes in cognition can be really scary. Sometimes it's hard to know if you should talk to your doctor or when you should talk to your doctor. This can be really intimidating. So an app like BrainTest can give you a little bit of information to help you decide whether or not you should reach out to your doctor. And when you do, it can give you the right topics to talk about. As with many other conditions, early detection for dementia is crucial. The earlier you know about a diagnosis or even some changes to your cognition, the earlier you can do something about it, and the better equipped you are in your fight against dementia or cognitive impairment. So let me tell you about the BrainTest app so you can decide whether or not this is something that you want to download and use yourself. You may have noticed that I actually don't have my phone app. And that's because the BrainTest app is only available for computers, which is what I'm using, or tablets. You can't download it on a phone. So the SAGE, or the Self-Administered Geroncognitive Exam, which is housed on this app, was actually designed as a paper-based test first. So it is now available on this app, and they designed the app to be similar enough to the paper-based version that it would ensure comparable scores, so that it wouldn't matter whether you took the paper version or the electronic version. You would get a valid score either way. So let's take a look at what this app interface looks like. So I really like the simplicity of the BrainTest app. The test on this app is self-directed. Nobody has to give you the test. It progresses as you interact with it. There's also a tutorial to help you learn how to interact with the test so that you don't need to worry about your technological abilities or lack thereof impeding your score. You can see how nice and simple the interface is for this app. It's really well suited for both those who have a lot of experience with technology and if you're kind of new to technology. I already took my SAGE test, and you can see here that I'm able to check my results at any time. So it did take a few days for those to get scored. Once your test is scored, you'll be able to see the results on this interface, and you can look back at your answers if you like. One of the things that I really appreciate is that I don't just receive my score. I get a nice video overview, and you see here a physician that tells me what I scored and what this probably means. I can then take this video overview or this information, my score, and discuss it with my healthcare provider if I have any further questions or concerns. So it gives me nice baseline information that can be used to get the conversation started if I do have concerns with the results that I find, or if the physician in this video reports back to me that perhaps I should reach out to my healthcare provider. Now, you're able to retake this test every 6 months. They have several versions of the test, so they'll be slightly different, so there's no learning curve that would affect your scores. So a few of the questions on the SAGE assessment actually have to be graded by people, or scorers. So your test scores are sent out to a core lab where scorers look at these questions and then grade them. Now, this shouldn't cause any concern for your privacy because these scorers don't know whose test they're scoring. You might also be worried about human error. What if your scorer were to review these questions and give you a lower score than what you should actually get? Well, actually, they've already taken steps to ensure that this doesn't happen. So 2 different scorers independently look at these questions and provide a score. If their scores don't match, a 3rd scorer is introduced, almost like a tiebreaker. They've taken steps to reduce the risk of human error so that the scores you get back are valid and they provide insight into your actual condition. over a few years, you'll have several test scores that you can go back and compare. Well, actually, the app does this for you. So you can click track your results. You see here only one data point for me, as I've only taken the test once, but had I taken it several times, I would be able to see if my score has changed and what those changes look like. Again, giving me information that I can take back to my healthcare provider and start a conversation if needed. So now I'll go down here to the very bottom where it shows articles. And you can see there's a nice blog article that I can read if I'm just looking for a bit more information or to stay up to date on the evidence and clinical recommendations related to dementia. And you can see there's quite a few articles available here through the Knowledge Center and then the blog that they provide. So again, just some information if you're interested. If you're still looking for more information about dementia, if you want to understand this condition a little bit better, I really recommend their interactive guide to Alzheimer's. If you click Begin Your Journey, you see they have some nice information here, some graphics so you can do a bit of exploring. I really appreciate how clear everything is laid out and how simple this interface is. It's not overwhelming. It tells you the information in a very clear and unintimidating way. Then you get the opportunity to do some interactive questions. You can see here at the bottom there are several tabs, so symptoms, risk factors, and then of course my favorite is prevention, so what you can do. For each tab, there's a number of different pages here. You can click through at the bottom. You can use either the arrows or just click on the page numbers to jump forward and back. You can see here that some of the images are interactive. If you click on the little plus icons, you get a little bit more information. I appreciate these pop-ups. They keep the actual interface of this app very uncluttered while still giving you information if you're looking for it. I love the motivation behind the BrainTest app, and that's to help individuals detect early changes in their cognition, so those early signs of dementia or mild cognitive impairment. And with that early insight, you're more empowered to do something about it, so helping to eliminate the fear and replace it with empowerment. Today's video was created to tell you about the BrainTest app, give you an overview of what it does and my thoughts on it, but as always, this is not intended to be medical advice or recommendation. I'm not that kind of doctor. Thanks for watching today's app overview. Please subscribe, like, and follow.